I love her voice. Their voice. I don't know their gender.
So one quick note before we begin, all of our panelists have been invited to speak to share their knowledge and experiences with the community. Their appearance does not indicate any support or endorsement of Kelly Ransom's campaign or candidacy. This is an information gathering effort for the community at large. We thank everyone for their time and for sharing their knowledge and experience with us. And before we actually officially begin, I should also introduce myself. My name is Molly Goodman. I am Kelly's neighbor, friend, campaign volunteer, policy advisor, any number of things on any day. So my day job, I run the homeownership and counseling programs for Alston Brighton CDC. I'm also the interim executive director of the Midas Collaborative, and I'm founding board member of Abundant Housing. So I know quite a bit about housing, and I'm hoping that I can also contribute to this Hall for Progress. And I think with that, I can turn it over to Kelly for her introduction.
Awesome. Thank you, Molly. Molly's been fantastic helping organize this whole event. So my name is Kelly Ransom. I'm running for Boston City Council District 6. All of this information can be found on my website. I really tonight want to focus on the people who are here and not myself, and the conversations that I find to be, they're going to be really valuable now, or if you're watching later, to give a better understanding of housing and homelessness and the connection in the city of Boston. When this campaign started being formulated, I knew that, sorry, I live by the J-Way, it's really loud. I knew that I wanted to host conversations like this to share knowledge with the community and invite so many people I've met along the way throughout my life who have inspired me, and talk to them and give them the platform and learn more from them. So we have lots of these planned. You can see them on the website, votekellyransom.com. I don't want to take up too much more time, so just email me if you have any questions, and they'll put information on the slides in the end and all that. And that's all. If you want to learn more about me, go to my website. Tonight's about our guests.
Perfect timing, because I just changed the slide over to our agenda. I'm going to stop sharing my screen in just a second, but I wanted to give a preview of all of the change agents that we've invited to this Hall for Progress. And our very first one is Larry Siemens, who is president of Family Aid. Welcome, Larry.
Thank you, Molly.
Hi. I'm just going to wait till she stops sharing her screen. Awesome. Larry. So
Hi,
good
Kelly.
to have you here tonight.
Thank you so much. Thank you. It's a delight and a pleasure to be here.
So I've had the pleasure of meeting Larry when I worked at Boston City Council, and have followed his work since then. And it's really amazing work that he's doing and the organization Family Aid is doing. So I'm going to pretend I know nothing. That's how we're going with all of this. So what is the mission of Family Aid, and why was it started?
Oh, great. Well, that's a great question. So Family Aid, we have a two-part mission. It's a two-generational mission. Our first portion of our mission is to help families, children, and parents who are facing homelessness to actually find, sustain, and maintain their housing. And the second is, as we're working with parents on kind of a more macro housing challenge, we also want to make sure that we're helping parents and children build really strong foundations for their future. So in essence, trying to break a cycle of two-generational homelessness. So that's what we were founded. We were founded back in 1916, actually. So
I did not know that.
Yeah, 105 years. And originally we were established by volunteers who could see families coming off boats and train stations and arriving in our city without any support. And so at the time we were a volunteer organization, and volunteers would come and help families connect to housing, employment, and education for their kids. And so we continue to do that. Probably one of the big switches over the time is the fact that we've now focused, rather than just on newly immigrated populations to actual Boston residents who've been displaced because of the incredibly high cost of living in the city. So in the 90s, we kind of changed our focus to existing residents in Boston who've been struggling with that. And then most recently, actually, we moved from downtown Boston, where we were close to train stations and the docks, to actually District 6. So we're actually, our headquarters are in your district.
I love that. I was so excited when I found that out. I didn't know that about how long you guys have existed. That's amazing.
Yeah, a long time.
So for our audience, about how many families in Boston are experiencing homelessness in 2021, and how is that data determined?
Yeah, Kelly, that's a really good question. And unfortunately, it's a rather large number. So tonight, as we're having this conversation, there are more than 10,700 children and parents who are homeless in our city. They're either in shelters, in emergency rooms, or living in their cars. Very rarely will you find a homeless family actually out on the street, because they know if they're out on the street, the police will come and take their kids away.
Right.
So it's a little bit than some of the other homeless populations the audience is going to hear about tonight. But we have 10,700. So 2/3 of them are in the situation I told you about. 1/3 are actually living in what's called doubled up. And
Yep.
I'm sure Elizabeth will talk about this as well for teenagers. Oftentimes when families are struggling economically, what they'll do, especially during the pandemic, is they'll go live with another family, which actually puts both families at risk, because oftentimes families are living in overcrowded situations and they're kind of breaking kind of key laws about how many people, especially unrelated people, can live in a particular space. So that's a real challenge for numerous homeless populations, including children and parents. And how that's determined is once a year. And Kelly, I know I have seen you at these events, Elizabeth, some of the other people in RA. There's a homeless census done every year to determine on a nightly basis how many individuals, family members, unaccompanied youth are actually experiencing homelessness. And then on top of that, the Department of Education through the Boston Public Schools also accounts for youth who don't fit that description. They're not on the street or in the hospitals, but are doubled up. And so the Department of Education counts unaccompanied youth and then youth with children. And that's how we get to that 10,000 number. It's really daunting.
It's incredibly daunting. And the doubled up experience is the experience that I had with my family. So I'm glad that it's being talked about more now than I've ever heard it talked about before, because it's important for people to understand that also is part of this population. So pretend I know nothing. How has the scope of family aids work changed because of COVID-19?
Yep, that's also a daunting question. So the week before the pandemic, we were serving daily about 1,600 children and parents. And right now we're serving over 3,000 on a daily basis.
Wow.
And the reason why the number has increased so much is that the pandemic has put families in particular in really tenuous situations. So if you think about it, and many of your constituents probably have children, right? Our kids going to BPS had to do it virtually. So when the pandemic started, a lot of businesses closed. So a lot of working families lost their jobs or lost work hours, which put them in danger of becoming homelessness, because many of us live paycheck by paycheck, right? One little thing can push you there, right? Secondly, the parents who had the opportunity to work had to choose, do I leave my 10-year-old or my 8-year-old or my 12-year-old at home by themselves while they're going to school virtually, or do I go to work? And so unfortunately, we put families in this really tenuous situation where they're choosing their children first, right, to keep their families intact. And as a result, the numbers of families, the numbers of children and parents coming to us has almost doubled over the course of the pandemic.
And I know that you changed some of the initiatives that you do because of COVID, or?
Yeah. So generally what we do is we provide three things. We have provided housing. So we have about 270 families who are housed, who were previously homeless, where our case managers actually provide supports to help make sure the families are reaching a greater level of stability. Second, we provide emergency shelters. So these are scattered throughout the city, and we have 130 units of shelter right now. And then we have something called prevention. Families who are kind of teetering on this edge, who may be doubled up, or they're struggling, they're in the process of being evicted. And that's where the growth of our programs have actually occurred, right? Families who are really teetering because of the pandemic. On top of that, one of the things we found out when we surveyed all our clients and the people coming in is the majority of the families we're working with, more than 50%, didn't have enough food to get through the week. So when we think about certain neighborhoods and populations, and you kind of think, where's the closest grocery store? There are pockets in the city of Boston that have something called food deserts, right? And I would even say in District 6, there are probably some neighborhoods where like getting to a grocery store is not the easiest thing to do. And so families who are experiencing, there's now no public transportation, people are being told like, don't go out with your kids. They literally had no food. So we had to start a food delivery program to 400 of the, which is about 1,200 kids and parents of the neediest of our families. So we've surveyed them. And since April of last year, we're providing over 7.5 tons of food door to door to the families who really don't have an option to go get food on their own. Either they don't have the money or they don't have the access to food from some of the great programs. You know, the BPS has food sites, pop-up sites at schools, a lot of other things, but a lot of families simply just can't get there because they don't have the public transportation access or the ability to leave their kids alone. So that's what we've had to kind of supplement the current work that we've been doing. And unfortunately, we think we're going to be in that business probably until school starts again in September, because 50% of the families are saying that they can't survive without our additional support.
Well, I thank you for taking that on, and the food access and housing, and it's all connected. What we're learning through all these halls of progress is literally every policy area ends up being connected. So you touched on it, but how does family aid improve the lives of families experiencing homelessness, and how could the city help to expand the scope of work?
Sure. Yeah, really good questions. So generally, our focus has always been on providing kind of case management, counseling type of support. So if you think about a family who might be struggling right now, so a mom, single mom maybe with a couple kids, right? She's really trying to like deal with the big issues in life: housing, food stability, jobs, right? And meanwhile, kids, their needs, oftentimes the parents are so focused on what we call Maslow's hierarchy of needs, like the most important things. Other things for kids, like their social development, their overall psychological well-being, fall to the wayside, not because mom or dad don't want to pay attention to it, it's just they're struggling with so many big issues. So what Family Aid has tried to do is not only help the parents with those big Maslow's issues, food, clothing, shelter, but also those kind of what we might consider secondary issues, but are really important, which is child development, and helping parents make the necessary connections to other referrals, resources in the city to kind of make sure that the family is holding together. And that's one of the reasons we're really proud of the work staff do. 98% of our families, once we get them stabilized in housing, they're still there a year later, which is among the highest rates in the country. And we really attribute that to all the clinical support that we provide families as they're going through this really horrific experience.
I'm so grateful that you do this. Is there funding that comes from the state or the city, or are you just fundraising? How? Yeah,
all of the above, and I'm sure you're going to hear that from other clients as well. The one thing you had asked about it, like funding, I think in terms of the city policy, I think there are a couple things that kind of stymied, which again, I don't know if your audience knows this, but Boston is ranked number 10 in the country for the total number of homeless populations. And that does not include the unaccompanied youth and children who are doubled up in families. So we're number 10, even though we're the 21st most populous city. A lot of the attention of the federal government that passes money to the city, right? So the city funds, a lot of funding for homelessness comes from the federal government, doesn't include those core populations. It doesn't account for them. And therefore, in many ways, the city is underfunded for the populations that we're struggling to support. That's why we're number 10, right? The cost of living is high. There's a lack of low income housing. We talk a lot about affordable housing, which is really important for teachers, social workers, right? We want housing. And yet there are families, there are over 100,000 children and parents in the city of Boston who are living underneath the living wage, and 30,000 are living below the poverty level.
Yep.
And we simply don't have enough housing for those populations. So when you ask about city policy, I think we have to start reflecting kind of the broader, it's called McKinney-Vento definition that includes all families under duress. The city tends to head towards HUD, which HUD doesn't want to count all those other people because that number is too big, right?
Of course.
But I think the city needs to gain a perspective on this larger perspective. We have to identify additional supports for those families, and we've really got to push the envelope on trying to maximizing low-income housing as well as affordable housing. So right now, there's some city councilors are working. There's a gap. We can add like 30 or 40. It doesn't sound like a lot, but it is 30 or 40 additional units of public housing because we're not yet at the maximum federal threshold. And so that's really incumbent upon us as well as to push, I think, for we have housing for, it's called AMI. I think you're going to talk about it a little later. A lot of affordable housing is set at a very high AMI, which is really to help young professionals get housing, which is really important. But we've got to also lower that a little bit for like working families, right? And teenagers, unaccompanied teenagers, groups of populations that don't have a lot of income because there's not a lot of housing for them. So those are some things I think policy-wise that might help in the long run.
I completely agree with you. And we will, anyone who doesn't know what AMI is, area medium income, we will find out shortly in a presentation from Molly. So I'm asking everyone tonight because I know what drives me to do this work, but I'm always curious, what drives you to do this work?
Yeah. Well, I have several different life experiences. The first is I grew up with my uncle and aunt, their child, my grandparents, and my 6 brothers and sisters and my parents. So 13 of us living in a 3-bedroom house. So, and that was in rural Pennsylvania, which you can get away with in rural Pennsylvania. You cannot get away with that in Boston without being evicted. So I was fortunate to live in an area that kind of turned a blind eye to that.
Mm-hmm.
But I know what the experience is of, sharing one room with 13 people. It's kind of a hard way to live. Secondly, I have 2 children that my spouse and I adopted, and they experienced homelessness in their original family. And because there weren't supports for them early in that stage of their lives, they ultimately became homeless and the family fell apart. And what I would like to see and what drives me is that I hope there are fewer families that experience what I experienced personally and also what my children have experienced. And that's what drives me towards this work every day.
And thank you so much. It's some of the most important work, if not the most important work that needs to be done. And you're an inspiration to me, and I've learned a lot from you. And I'm just really grateful that the city of Boston has you here and it working on issues like this. Before we move on, is there any information about upcoming events or things we should know about with Family Aid that you want to plug real quick?
Oh, well, thanks. Well, I was just going to say, anybody in the audience, if you're interested, please take a look at our website. We have a lot of activities going on. Right now, we're really pushing federal programs for food have actually disappeared. There's been a push to move funding for people through earned income tax credits. And so we're coming up shy with food. So for some reason, you're not eligible for that tax credit, but you're still hungry. There are no programs. And so we're pushing really hard to get people to get to behind food services, because I think we're going to have a gap until our public school programs and their free programs for food come back online in September. So I'm hoping people will jump to the cause, not only for Family Aid, but for other agencies across the city as well. There's going to be a big need for food this summer.
Absolutely. Thank you for sharing that. And that's really important. And thank you for being here tonight and taking time. I know you're super busy, so I'm really grateful for your knowledge and just your presence. So thank you, Larry, so much.
Well, and thank you for championing the cause of so many people who really need the support, Kelly. Thank you.
I'm trying my best. Thank you.
Thank you, Larry. I think this is my role to jump in and introduce
You're
the
doing
next. Okay.
Perfect.
Our next change agent is Elizabeth Jackson, who is the executive director of Bridge Over Troubled Waters. Welcome, Elizabeth.
Thank you for having me.
Thank you so much, Elizabeth, for joining us tonight. I'm going to jump right in because we have so many guests going on, and I'm so grateful for you to be here. What is, for those who pretend I know nothing, I have to say that to everyone. What is the mission of Bridge Over Troubled Waters and why was it started?
Bridge Over Troubled Waters, we support homeless and runaway and at-risk youth ages 14 to 24. Our goal is to meet young people where they're at and provide support and guidance for youth on their path home towards a happy and healthy, stable adulthood. And we do it in, I always say, we're the University of Life Skills for kids. Our approach at Bridge is focused on the whole child. So we provide clinical, counseling, outreach, education, career support, life skills development. In addition, we provide a safe place for our young people to live. So every night I close my eyes and I'm like, we have 200 young people living in all over Massachusetts that they're my babies, they're living with. And that includes about 5 or 6 babies under the age of 2. So I get really nervous every night. We started and we're 50 years old. So the agency just recognized being 50 years. We started in 1970.
Congrats.
I always say, I know I don't look that. It was started by the Sisters of St. Joseph back in the 70s when Woodstock was going on and so forth. They were teaching in the parochial school, but noticed that a lot of the students coming into school were using drugs, were not eating, were not home. So they started giving out sandwich at the Boston Commons, and they started that. So our street outreach program started in 1970. And by 1973, we had street outreach, our medical van, and our dental clinic. And it was really just focused on what the young people needed then. And the street outreach team noticed then that the young people were not going to Woodstock. They didn't have any place to go. And back in the 70s, you couldn't just go to a hospital. You couldn't do anything. And so that's how we were started.
Amazing. Sandwiches. Like
Yes.
one of the simplest things, makes such a big impact. I think you might have just mentioned it, but I just want to ask again about how many youth in Boston are experiencing homelessness in 2021, and then how is that data determined? And if it's the same as how it's determined for family aid, that's cool too.
It's not the same, actually. They're very undercounted.
Yes.
Young people fall through the cracks because they either counted with families or they counted through DESE, which is Department of Education. So the Department of Education does a count every 5 years. The last count was about 5,000 unaccompanied homeless youth that they reported. We have our data that we collect. So we at Bridge see over 2,000 young people a year, individual young people. And the homeless youth count, and is that the state provides. So we're the PIC count that Larry was talking about, that we go and count. So that it's different for young people because we have to get it for a 2 weeks period. It's not a one night. And our young people actually, it's really hard for our young people to come open about their homelessness, right? It's embarrassing. They have different situations. They hide it from friends, teachers, co-workers. They're staying at your friend's house. So for our listeners, if you have a teenager, a child, and you have another teenager sleeping over and that's their friend and they've stayed over there for 2 or 3 days, you should probably figure out what's going on, because it's couch surfing, right? So they move from family to family and friends to friends. And so the collection of that data, it's really severely undercounted.
Yes. And that's what I did when I was a teenager. And I thought I was being independent and cool. And that was a defense mechanism. I was experiencing homelessness. And I'm glad that it's becoming more known that couch surfing is a part of that experience, especially for youth. So how has the scope of the bridges, I'm just going to shorten it to the bridge because that's how I've always called it since I was a kid. The bridges work changed because of COVID-19. I can imagine there's been some adaptation.
It was, we had to stay open, right? We could not, I remember when I still remember feeling it, right? And I think everyone will experience this through the pandemic. They remember where they were at when they were like, oh my God, is this really happening?
Yeah.
And I remember sitting in my office and the staff looking at me and said, what are we gonna do? And I said, I have 200 young people living in our houses that we own, right? Throughout the state. We can't shut them down and send them, this is their home. And I remember sending an email to the staff at the residentials because they asked, and I said, we're like a hospital. We have to stay open 24 hours. And so we tilted and we expanded into Emerson College. So we opened Emerson to the partnership with the city of Boston and to the state. Emerson was closed, so we asked them for a floor. They provided a floor for us to provide so great
Nice.
distancing. So we pivoted on a day. It was a daily basis and a daily email. Like, what are we going to do today? We took our education floor that most of our young people did not have access to internet, did not have access to a computer. So education wasn't really happening. So we took that floor and made it a COVID floor. So if any young person, which we did, were exposed and needed to be quarantined and didn't have nowhere to go and were homeless, then they can quarantine on one of the classrooms and they were there with Netflix and spend the time. We had a lot of food that we gave out. Food was even to the young people that were living in their own apartments that were under an umbrella. They couldn't go out, they couldn't figure out. So we had to deliver foods. They were sick of sandwiches. So we're getting a lot of donations coming in because we couldn't buy food. BJ's would not place our orders. Everything was back ordered.
I remember, yeah.
So it was really tough. And they were tired of McDonald's because that was the only thing open. So it's like, okay, we'll have McDonald's. After the second week, it didn't work out well. So we pivoted really much on making sure we stayed home, having, anyone that has teenagers, I have two teenagers, having two teenagers at home alone is enough. Having 15 in one house with nowhere to go, we had to be very creative on keeping them active.
Oof. Yeah, I can imagine.
Yeah.
Well, that's amazing that I didn't know about that partnership with Emerson. So that's really awesome that was able to happen. Pivoting a little, what are some of the unique barriers that youth face when they are experiencing homelessness or housing instability in Boston?
I'm not sure this is unique to them. Well, one thing is unique to them, where's the age range, right? So they don't have credit, they don't have savings, their job is not able to maintain for them to sign for an apartment, and nobody wants to rent to a 19-year-old or even a 20-year-old. That's, if you don't have
Right.
to sign that lease with you to be the creditor, no landlord out there is gonna put the risk on it. So that's really unique to our population. And the housing costs, as Larry mentioned, is ridiculous in Boston. Forget our young population, even for our staff. I have staff that are in New Hampshire and Rhode Island. They like in other states. It's so expensive, right? Education and employment opportunities that provide youth a living wage, so they're not having that. So that's unique to them. They don't have a living wage. But Larry, it's not unique because it's our families are also struggling with that. And there's no age appropriate housing or services for a young person. So when HUD creates units, they create just units. They don't create, and that's a building, right? They don't think about the person who's in that building or the supportive of that building. And so our population actually, they call it a subpopulation. It doesn't really get looked at as much. And so that we're constantly either using private dollars or donors that support our agencies like myself to keep going, because there's not a lot of dollars associated with the state or city directly to this population. It's starting to move and change, yes.
Yeah.
But
Oh no, I didn't mean to cut you off. I was agreeing with you.
that was it.
So I know city and state policy would help with to help end youth homelessness in Boston, but it also sounds like federal help would probably be key in this situation.
Yes, in Massachusetts, actually federal, it's much more supportive to homeless youth than the city or state. In a way so the way I would see is there's no, so like DCF has dollars and they have service dollars to support young people, but you have to be on the DCF contract to do so, right? Or you have to be on the DCF care. And so what we need to do as a state is really to merge, and I always call it the alphabet soup for the listeners. This is like DYS, DDS, DHS, DCF. There's a lot of Ds, all the departments.
All the Ds. Yeah.
they don't really work together and from passing a young person's age from one program to another. So if a young person ages out of DCF, but really need DMH or the Department of Mental Health Services,
Mhm.
there's really a good bridge, no pun intended, to provide the services so the services dwindle down, right? So there's no exact funding from the state of Massachusetts. There's the Unaccompanied Homeless Youth Commission that was I want to say put together 3-4 years ago, and it has about $3 million for the whole state to support. And Boston sees 2,000 young people, so $3 million is it's really us to count, right? The state through the city through money from HUD has a pilot program for the YHDP. It was a youth pilot program for housing, which is the rapid rehousing, but
Mhm.
it only for units, right? It's for housing, not really that supportive services that our young people need. So right now, these groups are all working on their own systems, like I could say the alphabet soup, in order for best for to support our young people that are experiencing homelessness. We must align the efforts and work collectively to support our young people.
I completely agree with you. And when we get to Leslie, she's gonna, I think, touch more on the supportive housing piece of things and why that's important for our youth. So I'm asking everyone tonight, what drives you to do this work?
You know, I worked with adults and I worked with babies. I like working with teenagers. I love that they come to you with their head down. They don't really talk much. They drop the F-bomb. They read you like it's no tomorrow. And a year or two from now, you see them and it's a whole different person, right? They're 2 or 3 year span that we have with them, we can literally change them. So developmentally, they really are young. Anyone that has teenagers, they really need support. And to see them trying to take care of themselves, but needing that support and breaking that barrier, and then seeing a 16-year-old coming to us to DCF, and now he graduated from BU while we were in the pandemic, and now he's doing amazing. That keeps me going. It's like the young people need support, not just our young people at Bridge. My 2 kids, Larry's 2 kids,
Yeah.
families, they need people to push them and get them through. And so that drives me, because I know if we give them that path that we see, we have about 87% of our young people that go through our program are very successful in doing well, graduate college, got their jobs, got wives, got kids,
Oh God.
we have firefighters, we have police officers, we have doctors, so that have been through Bridge. And so that gets me going, because it's, you know, that we all need that little push. And for people to feel like, oh, an 18-year-old could do it all on their own, it's just not with the systems that are out there. They're not there to support them.
Right. Oh, that's beautiful. That makes me so happy, because I can completely relate to the path of experiencing homelessness, and now I'm running for city council. Like,
Somebody did not give up on you, right? And somebody pushed you and stayed there with you and through all those situations. And when our young people look at them, it's very different. When you think of homelessness, people have this visual of like streets, dirty and stuff. And our young people, we had a young person that was in Northeastern walking around with a backpack, and that's where he slept for like 6 months until the cleaning lady rat him out. So they're really creative, and they
yeah.
there, but there's nobody there to support them. So I am so proud of you, and that's what keeps me going.
Oh,
That's
thank
what
you.
chance and a little push. We can all do it.
I'm so grateful for you and all the work that you do. Before we move on, I just want to ask if you have any upcoming events or things you want to plug, or last comments to
Thank you.
say.
So yeah, please go to our website. To your listeners, we have a podcast series. It's actually produced by a young person from Bridge, and he interviews key members of the Bridge community. So it's really insightful and different approaches. We also have the Homeless Youth Month. If anybody did not know that, that's November. So November is Homeless Youth Month. So please find us on Facebook and social media and really start talking about it, because 1 in 13 are homeless. So if you look at a basketball team, if you look at a soccer team, if you look at a basketball team, one young person in there is struggling. And so we need to bring awareness. So thank you for following us, and check our website for all this other stuff we do with volunteer and stuff. So, but thank you for bringing this to light and to having me here.
Thank you, Elizabeth, so much. I mean, this is important to District 6, but this is like a Boston thing, period. So I just hope that people, even if people watch this like 3 years from now, I'm happy to have this information out there. So thank you so much for joining me tonight. It's
Thank you.
been
And
an honor.
I'm in Boston, but we serve all Massachusetts and anybody. If you're under 24 and you show up, we don't turn you away. There's nothing there. So we serve everywhere. Our young people come from everywhere.
Perfect. Thank you. Thank you so much.
Thank you for having me.
Thank you, Elizabeth. Our next change agent is Ari Barbanel, who is the Executive Director of Winter Walk.
Hi,
Hi, Ari.
how are you?
I'm good. How are you?
Great, thanks for having me.
I need to preface you with a special preface before we get into our questions. So Ari started a podcast with the Winter Walk like over the past year, and they approached me to tell my story, and I had never actually told my story for the first time. And that's really, it was such a small moment in the past year, but it's actually gotten me to kind of being here today, to be able to even host this forum and have these conversations, because I had a space to tell my story. So I just want to thank you for that before we get into everything, because that was like
Thank you.
really impactful in my life. And if you haven't heard their podcast, I'm sure we'll talk about it, but like make sure you go listen to their podcast. So thank you for joining us tonight. I'm just gonna start off real quick. What is the mission of Winter Walk and why was it started?
Yeah, Winter Walk is an initiative that raises awareness and funds towards an end to homelessness in the greater Boston area. And we do that through year-round work, trying to gather resources, create opportunities for education, connect to amazing service providers here in Boston, like Family Aid Boston and Bridge Over Troubled Waters. And we culminate our work each year in February, the coldest month of the year, with a big event, a walk outside, together as people who are housed, homeless, everything in between, to show our support, our care, to walk a moment in the shoes of somebody who may not have a choice where they are on a very cold day. And we celebrate making change and changing perception together with a 2-mile walk and a community breakfast and stories that we share together. And then we start again until we don't have to walk anymore.
I can't wait till the day where we don't have to walk anymore, but it's so beautiful. It's such a beautiful event. And the way that it was adapted for the past year, where it was like you go on your own individual walk, that was really creative and really nice to see that it continued. So I asked about families, I asked about youth. I'm going to ask about to you about how many individuals in Boston are experiencing homelessness in 2021, and how do you know that that data is being determined?
Yeah, I'm so glad that I get to be the third person in this conversation, because I think you've already seen how difficult it is to gather data.
Yep.
Homelessness can be so invisible. And so when people are doubled up as families or as youth couch surfing, we're missing so many people. So we throw out numbers as best we can, and that never tells the whole story. So, I think it's incredibly powerful to say that the point in time count that we all do together, usually also on a very cold night in January, this year that was close to about 5,000 people counted. And that's definitely not everybody. We just talked about there being 5,000 students in the Boston public school system. We just talked about 10,000 people and families. So I think there's a real challenge in addressing different populations of people experiencing homelessness, and how the issues that surround those populations of homeless individuals and families and young people is different and deals with different issues, and we address each one of those issues to make a change.
They're all completely unique, but I feel like we're never gonna ever know the actual full-on number data, because there's a lot of hidden homelessness. Like what I experienced was that. And a part of what you do, I know, is to end the stigma of that, and that's really helpful. And I think it's great. And I think it's going to grow across the years of Winter Walk existing. So Winter Walk, I believe, has a very bold belief in that ending homelessness is within our reach. And I believe so too, but I'd love to hear how you believe that ending homelessness is a possibility in Boston.
Yeah. It's kind of a bold statement we make, right? But I truly believe it. Our organization believes it.
I believe it.
Good. I think there's a couple answers I'll give tonight. There's plenty of answers I can give. I think one way is to listen to the words of our incredible local service providers. So you heard from both Elizabeth and Larry some of the things we need to be conscious of, some of the policies that need adjustment, editing, support. In your own communities, in your own neighborhoods, you can make an impact, a real impact. And so what we're doing is the Winter Walk is, like you said, changing perception, breaking stigma. And we believe that some of that change in perception is the key to systemic change. If you are a person who can shift your perception and recognize that homelessness can happen to anyone, and that the issues are vast, and that trauma is such a big part of what people go through before, during, and after they experience homelessness. And if we can think about that differently, then we can start taking action differently. So I stand by and have plenty more policies we could talk about, advocacy moments we can get involved in, and that's what being involved in the Winter Walk is all about. But step one, and what the walk is, and what it launches, is this idea that if we can shift a little bit on how we think, we can then be part of the change.
I completely agree with it, and you have helped me do that. So I think it's a really effective model, but you said the word policy a few times, so let's talk about that real quick.
Yeah.
If there was a policy, or you could talk about a few if you want, that you could see put in place at the city or state level to help end homelessness in Boston, what does that look like? What could that be?
Yeah, I'm interested in what the city's capable of. We're rooted here in Boston. We're about greater Boston, but I think I've watched so much success in our city around individual homelessness because the city has a lot of impact in that sphere. But
Yep.
right now we're in crisis mode when it comes to young people and families, and these numbers that are rising. It was already crisis mode pre-COVID, so now it's even scarier. So what can we as a city be looking at? I think one of the biggest areas of policy is around prevention. I'm really interested in the areas of mental health support for students in school systems, and providing more resources so that families can stay together, can prevent being evicted, pardon me. And I think there's a phrase that I hear in working in this sphere, and that a lot of us use, is that we want homeless to be brief and one time only. I don't think it should even be one time only. So how do we get ahead of brief and one time only? How do we get to methods of prevention? How do we think differently so that we're making these changes, enacting these housing needs before we're dealing with crisis?
Right.
It's going to take us a while to get there.
A reduction in homelessness, basically, because the people that I know personally and myself have experienced it more than once throughout their lives.
Right.
And that's a statistic I should have written down tonight, but it's a common thread. If you've gone through it once, it's more likely that you go through it again in your life.
And it's generational. And I think that's what Larry and Elizabeth and their organizations are dealing with, is trying to address the needs of young people so that it's not going to happen again, and it's not going to happen to their children.
Yes. Yes. So important. So asking everyone, what drives you to do this work?
I think it's that realization that I think I had when I got started in this work, is that we're all human beings. There's a deep connection between all of us, and every human being deserves a chance to be housed and healthy and loved. And I think that's the root of it. And then in the beginning the work, I get to meet the most incredible people from all walks of life. So this work has led me to partnerships with the organizations you're speaking with now. It led me to you. And I think the people that I meet and the stories that I hear and people who have experienced homelessness and their willingness to share and trust and activate other people to support others and make change is really why I do this and will keep doing it.
Thank you for doing it. And it is a chain reaction because really you just need one person to ask or see one person share their story to, you know, maybe inspire someone else to do the same. And it is life changing because it's changed my life and I've seen it change other people's lives. So I'm so grateful for the work that you do. Before we wrap up, is there any information, upcoming events, things we should look out for with Winter Walk?
Yeah. Well, you mentioned the podcast already, and I love the Bridge podcast. And we get to talk to Elizabeth in one of our episodes. We talk with you, Kelly, in one of our episodes. Larry's part of it. We're like all a big happy family trying to make a difference. But the podcast is a 5-episode series that we launched with the walk this past February. And it's a really helpful way to learn a little bit more about the different areas of homelessness. So we focus on family, on youth, on individuals, on veterans, and tell a little bit of people's firsthand stories. And they're all really short. They're like 20-minute bites, and they're really beautifully shared with us. So we're proud of those. And then, of course, the walk happens in February. You can sign up for our mailing list on our website, winterwalkboston.org. And hopefully this year we'll have more opportunities to be together in person and leading up to February.
I hope so too. And I just have to point in real quick. You have like I listen to a lot of podcasts. You have one of the most soothing, nicest podcast voices. I think you have a future in that field for real.
I'm channeling my inner NPR,
It's just beautiful. I'm like, oh,
Thank
you. So relaxing. I can't believe this is her. Like, it's just so calming. But thank you, Ari, so much for being here tonight.
You.
And I'm so grateful for the information that you've given and the vision that you have. And I'm right alongside with you. So I think we're moving on to so we're doing a little, before Molly gets started, we're doing a little switch now. So tonight is about housing and homelessness. I did put homelessness, conversations first, because I think you'll see, I have a whole plan, but housing and homelessness are connected, but they aren't at the same time. And before we start really diving into the housing piece, there's a lot of terms, there's a lot of jargon. I've been in the affordable housing sphere for 5 years, and I still find myself in conversations where I'm like, wait, what is that one again? Because there's so many abbreviations and everything. So I really want to give a neutral presentation that Molly, who is an absolute expert in this field, to just sort of get everyone up to speed on some of these terms that you're going to hear when we talk to Leslie and Sam and in future conversations that we're going to have throughout this campaign. So take it away, Molly.
And one more quick plug for votekellyransom.com to learn more about Kelly as a candidate and her platform and all that fun stuff. And before I even jump into terms, I just wanted to add this brief timeline, mainly because there was a timeline in our slide deck template, and I tried to think of something appropriate for this topic. And these are things that I feel like I've learned in the last decade or so as I've been digging deeper into this world of affordable housing. So we used to build a ton of public housing from the 30s all the way up until the 70s, when President Nixon just did a moratorium on public housing. And just for clarification's sake, I wanted to add 2 events in between those times. Was the first Civil Rights Act, which meant that we could not segregate public housing anymore. And then the second Civil Rights Act, which actually had the Fair Housing Act, extended those protections even further. And then magically we decided that we didn't like public housing anymore. And so the next,
I'm just seeing a note that I think you didn't mean to leave in there.
I mean, I kind of did,
Okay, we're just gonna pretend that.
but I didn't. I mean, I did mean to delete it, but
It's an Easter egg. Enjoy, everyone. Vote for me.
and so then we still needed to build affordable housing because we always need affordable housing. We need more housing stock always. And so we sort of pivoted to using the tax code to do that. And that's still our current scheme for funding affordable housing. So while we still have a lot of public housing stock run by local housing authorities, we also have a whole new industry of community development corporations, private nonprofit developers, and even sometimes for-profit developers can build affordable housing and use these subsidies to supplement the construction costs and to pay their staff and to pay for materials. And then one last update on funding that we've had very recently is in 2012, the rental assistance demonstration was added. It's because that old public housing stock is crumbling and we need to invest in it and make it better and improve it for the residents, make it habitable. And we need money to do that. So it empowers local housing authorities to leverage the value of the land that they already have, and then builds market rate units at the same time to cross subsidize and improve the existing public units. And a note about that, actually can't see that one in the chain, but the Faircloth Amendment made it so that we cannot add new public units. That's why RAD is sort of a workaround. We can improve the ones that we already have, but we can't add to the stock, the number. So we should repeal that. And that's not something Kelly can do on city council, but
Sorry.
just a note. So subsidized rental housing, it's either going to be public housing owned by HUD or by the Commonwealth. And a note that Massachusetts is one of only 4 states that has state-funded public housing. So oftentimes, I always discover Massachusetts is like far and above every other state in the country. But for as much as we do and all of the hard work that everyone is doing, we are also the most unequal, the highest housing costs. It just doesn't square up with all the work that's getting done. And to elaborate that a little bit more, we are currently the 4th most expensive of the 25th largest metro areas for home ownership. And the rent burden for like moderate income families is astronomical, but it's so much worse for the lowest income families. And I put this map here of the 5 counties of Greater Boston because more than ever, this is extending out into the whole metro area. And we really can't even have this conversation about Boston alone. We are all in this together, and our suburban neighbors can't really escape. They benefit from all of the amazing things that Boston brings to the table. So it needs to be a regional conversation. And to that point, area median income is a number that is based on all of these municipalities that make up this Greater Boston metro region. And you'll see, I just put the numbers because it's always helpful to look at them, what the area median income is for these numbers of households. This is really important for programs like mine, like the first-time homebuyer programs, for clients to understand what they'll qualify for in terms of home ownership loan programs and down payment assistance. Before they can even get into the process of trying to buy a house, they need to understand what might be available to them. And they're usually very disappointed when they learn what the housing prices are in the city of Boston and the surrounding regions, and how much of a loan they would actually be able to qualify for, even though, I mean, they're really doing very well. You'll see that 135% of area median income for one person is 114,000. We are subsidizing housing for those people because that's how expensive it is to live in the city of Boston for young professionals. And these are some of the definitions of the terms. I'm not going to read them off, but we will make this slide deck available to anybody who wants it. Probably put it on the website.
We'll put it on Facebook like almost immediately. Yeah.
Yeah. So these are some of the things that I just mentioned. Section 8 is the main voucher program. Again, Massachusetts is special. We have a state-funded voucher program. So actually, and I think we even have a city of Boston funded rental subsidy that was just added in the last year or so. So we really do go above and beyond trying to reach these people. It's just that the need is so extreme and we are not building enough housing and we do not have enough housing units. And just to expand on my point about the suburbs, around this time in our timeline in 1969, we added the anti-snob zoning law to try and force the
That's what it's called?
The comprehensive permit law is the official name. If you Google anti-snob law, that is what will come up. It's even on the Massachusetts government website. So I'm not being outrageous here. So basically, if 10% of a town's housing stock is considered affordable or subsidized housing inventory, then the town is exempt from 40B. Until they reach 10%, developers can sort of bypass the local zoning regulations if 25% of the development will be affordable. To me, that's a crazy low bar, and they get to count all of those units, not just the 25% that are affordable. So I just always want to make this clarification that Boston's subsidized housing inventory is already at 20%. We are trying to do everything we can, and we just need other people to help us.
So can I ask really quickly before we move on to the last two people that we have, just to get it on video, what does market rate mean? Not that I don't know, I'm just saying I want it on the recording.
The market rate is just regular housing without any subsidies, how much it would go for on the market.
Moderate income?
Middle income?
Okay.
Oh, do you want like it's like 80% AMI?
Okay. Lowest income?
It's like 30. Very lowest is 30% and low is 50% AMI.
I'm not asking these questions because I don't know the answers. I'm just
No, but I don't know the answers. It's just not like I mean, I know them if you give me the chart, but
what is HUD?
The Department of Housing and Urban Development.
Thank you. And what is the BPDA? Because that is a question that was submitted.
The BPDA is the Boston Planning and Development Agency, formerly the Boston Redevelopment Authority. And all cities and towns in Massachusetts can have a redevelopment authority, just like they can have a public housing authority. So we're not actually that unique, but Boston's BPDA is special because Boston has our own zoning code and we made it complicated.
And then two more questions before I move on to our next fabulous guest. 40B?
No, anti-snob law.
Anti-snob law and Article 80.
Article 80 is Boston zoning code. Like we have our own. And so that is what we have in place of what every other town has with their zoning enabling act.
Awesome. I can't wait to share this slide deck. I know you worked really hard on it and I know it's a lot of information to go through in 10 minutes when we're already running 10 minutes over time. So, woo.
We can move on to Leslie, who will absolutely expand on everything that I just talked about. And the one other time I'll swear in this presentation is because we learned that there are people that get shit done, even though it's really, really difficult. And there have been a lot of obstacles put in place. And so Leslie is one of the people who I've always looked up to who gets shit done. And now she is the CEO of the Madison Park Development Corporation. So welcome, Leslie.
And we are lucky as heck to have her here tonight.
Thanks, y'all. I'm so glad to be here. I love to talk and I love housing. So I guess I'm in the right place.
I'm gonna pretend like we don't know each other at all.
Okay. That'll be hard, but okay, I'll try.
What has been your role in the landscape of creating affordable housing in Boston?
I kind of had like a personal professional journey. It's kind of like Goldilocks. There's a lot of seats at the housing development table, and I've tried most of them. And I think I ended up in the one that feels just right. But I started downtown working for a quasi-public that provided technical assistance and really early seed funding for all different kinds of affordable housing. It was a great way to get a good perspective of what housing development is about. And then I was like, oh no, I want to do it myself. So I went to work for a CDC in Jamaica Plain because that's where I lived. Back when I started this work, like I had bought a triple decker, so I was qualified to do affordable housing development because that's how it was. It used to be. It's not really like that anymore. It was tax credits and all that other yaya. And then I journeyed from doing that work in Jamaica Plain to doing it in Roxbury. I went downtown and I worked for the state on public housing and homelessness. And then I kind of went off the rails and I worked for a bank for a little while. It was a nonprofit bank, but still a bank. But I learned a lot about capital markets and the reality of that relative to housing. And then I went and I worked for a national consulting firm that did a lot of work around federally assisted housing, because like we said, there's lots of flavors of it. And I got, you know, kind of like a national view. I was really privileged to be on the ground of the implementation of RAD, which Molly referred to, which was, by the way, the brainchild of Sandra Henriquez, which is one of Boston's own. She ran the Boston Housing Authority and then landed in a very senior leadership position at HUD and threw out RAD as a life preserver for public housing. So we should pat ourselves on the back here in Boston for having an advocate like Sandy to provide that tool. I went back to Jamaica Plain and then I finally landed back in Roxbury. So like, I'm like Goldilocks. This is the seat that fits just right. One of the things, I'm tripping over my language, I kind of think the word affordable housing is intellectually lazy. Because it's like, affordable to who?
Mhm.
You know what I mean?
Mhm. I've been asked that
You
question.
know, we can, because we're among friends, we can be lazy and it's okay. I actually think it should be more properly referred to as regulated housing.
Mm.
You know, so the housing that we're talking about has rules, right? And the rules typically control the rent you can charge, how much you can sell it for, you know, the income that the folks can earn, and lots of other really weird, mean, rude rules. So when we talk about affordable housing, like it is kind of lazy. It's an inappropriate. It's like I don't know why we call it that. It's a really regulated housing. It's, as friends, we'll call it affordable, but
It's a buzzword.
it just means the government has some say over how you use it, right?
Right.
Right.
So besides affordable housing, there are other kinds of housing, and what other kinds of housing do you think are needed in Boston?
Well, let's just say something that had already been said, which is there's a housing shortage in Massachusetts overall, right? We need all the housing.
Right.
No,
Right.
whether you prefer low income people or rich people or whatever, we need houses for people, right? Our state has been growing and the pace of our construction of housing has not kept pace with the growth of our state. Kind of weird. Like I always thought like growth was a good thing. It's like grow or die. Like it's like grow or like recessions, which are like the antithesis of everything that we're kind of like brought up to understand. And Massachusetts, for a lot of reasons, which would be a different forum, hasn't kept up. And so I would say all the kinds of housing are needed. Including according to some people like dog housing. Dog parks and all this stuff. But
no, like that's a conversation we're having coming up.
All of the housing is needed. And I also like to note when we're having conversations about housing and homelessness, they're not the same thing. I think we too often artificially conflate housing with homeless or houselessness. And I think it's really important for us to draw that distinction because bricks and mortar are only a little slice of the pie of addressing the reasons people have instability in their lives, right? It's just one symptom of a lot more. So I just want us to, again, have some intellectual rigor and discipline in having this conversation and not artificially conflate two very different issues.
No, I completely agree. And I've been guilty in the past of saying like the cure for homelessness is housing. And guess what? It's not.
Bricks and mortar aren't a cure for anything.
No.
At the end of the day, if you think they are, you're mistaken.
And I've learned a lot. So I want to talk a little bit about supportive and transitional housing, because we haven't really touched a lot on that tonight. And I personally believe that that is important for people who are coming out of an experience of homelessness to have that housing available to them.
I agree with you. And, you know, we have the term supportive or supported housing. I mean, let's face it, the way that we build bricks and mortar houses, you have to be able to conform to very specific expectations about how you occupy that space, how you get into it, how you use it, how you leave it. And that works for some people, but not for everyone. And so I think what supported housing attempts to do is to, when you have the traditional bricks and mortar housing, try to create an environment that's inclusive of folks who might not otherwise be able to meet the really rigid expectations that we have, that we demand from people to occupy housing under traditional circumstances. And so, you know, I'll give you an example. One that's most familiar to us and that like everybody gets is, you know, senior housing.
Oh.
Sorry. Oh, I was going to say senior housing is the
No,
most
senior
obvious
housing,
one,
senior
right? You know what I mean? As people get older, we say, oh, you're not just gonna live alone, you're gonna live there and we're gonna help you with your activities of daily living. We're gonna help you with your food and your laundry and all this stuff. Like it's very familiar where we bring in the resources needed to support somebody to be successful in that particular bricks and mortar, right? And so that's a very familiar concept. It's just supportive housing is extrapolating that concept to other groups of people, you know, so that we can be more inclusive in how housing works for different, you know, populations. And so I think we're learning a little bit more about how to be thoughtful about that and to bring it, to design spaces, frankly, that work, you know, for a broader range of people, and also to bring in resources, right, human and otherwise, that make, you know, people's lives stable enough to occupy the physical space, you know, with any kind of stability or continuity. So that's just like blah, blah, blah. It's like, you know, I have a little bit of anxiety. I have a little angst about bricks and mortar as a solution to social problems. So when we say, oh, we're gonna make like housing for pregnant moms, I'm like, what the hell? You're gonna take all the people going through the same shit and put them in the same place? Why? Because it's convenient to you. Oh, I'm sorry, I'm not sure I'm supposed to swear. But
Christopher said like 6 swears on the rest of the round table. So
sometimes if people are choosing to be around other people that are like them, I think it's fine. But I get a little nervous, and I think we need to have a dialogue when we say, oh, we're going to build housing for that group, and somehow that's going to make their, you know, their challenges better. I mean, we have a lot of grandparents parenting their grandchildren. And somebody had the brilliant idea, like, take all those people and stick them in the same building. I'm like, what the hell? Like the grandparents are parenting the grandchildren because there are challenges in those families. And now you took all the families with all the same challenges, put them together and isolated them from everybody else. And I'm like, okay, time out. Can we have a little dialogue, right, about the wisdom of that? So I think we need to be really careful in bricks and mortar solutions, like tagging a case manager onto a traditional housing unit does not necessarily stabilize people fully. So I just think we need to, we're on the right path. Like we're learning, like, for example, we used to stick people in mental institutions, right?
Right.
That's how we used to do it. Now we build group homes, we integrate, you know, units for folks who might have mental health issues or disabilities into, you know, mainstream housing. So we're learning, but I have somebody who I learned a lot from who used to say the biggest room in the house is room for improvement. And I think the key to improving how we do this is to talk more about the folks we're trying to serve. Like, why am I sitting in my office trying to design something that serves folks, you know? And so I just think there's a lot of room, but I think the intention of supported housing is to bring additional resources to help people occupy, you know, housing as we've defined it.
Yes.
And I think that we have a lot of work to do to ensure that that is more inclusive, right? And has more consideration of the people that we're trying to accommodate.
That's a great answer. And real quick for people. Oh, you're the echo. For people who are not friends, not friends, but not in this sphere, who are watching now or later, difference between transitional and supportive housing, real quick.
Let's see, we have this continuum, I'm not judging it, right? One quick fact, fun fact, Massachusetts is the only right to housing state in it's actually a commonwealth in the country. So it's in our state constitution that we provide shelter. Now, there's a lot of nuance in the definition, right? But the idea is there. So we have a shelter system. We have a transitional housing system, which in theory is the bridge between what we call shelter and permanent housing, right? So it would be, you know, you're not in a shelter, right? Which is a place where you just sleep at night, right? It's not a home. Transitional housing might be somewhere you can stay all day overnight, but you're not intended to be there for the rest of your life, right? And it's supposed to be a bridge to what we call permanent housing, right? Which is you find your home, whether it's rental or ownership or whatever. And then within the spectrum of permanent housing, you might have that supportive component, right? Where there are services specifically attached to the bricks and mortar that you live in. So there's this continuum, so to speak.
So I'm going to completely accelerate the process because we all know this is not how it happens this quickly in Boston. But let's say, okay, you're a family or an individual or a youth, you've secured housing. Now what? How do we start having people be on the journey to owning a home and building equity and generational wealth? It's a big question, so I don't.
It's a really big question. And again, one of my recent mantras is inclusiveness, that we want to give people options, right? And so homeownership should be an option that people can access regardless of their kind of circumstances. But I also want to acknowledge that homeownership isn't for everybody, nor does everybody have to become a homeowner, right? So, you know, I think traditionally in the United States, for a lot of reasons, homeownership, you know, ensures a certain level of stability relative to your housing payment and your control over that space. It is also, you know, because housing has been commodified in our country, which means that, you know, it's like a commodity. It's a commodity to be traded and sold, not just for its use, but because of its value. And so based on the commodification of housing often becomes not just the roof over your head, the safe place to rest your head on your pillow, it's also your single largest asset, right? And so there's that dynamic as well. You know, from my perspective and from my current work at Madison Park Development Corporation and in the neighborhood of Roxbury in Boston, there is a very, very acute awareness of how government policies have systematically excluded Black people from the opportunity of homeownership. Whether homeownership is good or bad, I don't want to talk about that right now. I'm just saying Black people couldn't have it, right? And people are acutely aware of that. And so as a result, if you go and talk to a lot of people in Roxbury about what they're looking for, what's missing from their housing choices, it's homeownership, right? It's the legacy of those really racist policies. And so we're working really hard to think about how to put that option on the table for the people who want it, right? Simply because they're asking us for it. You know, I have, like I said, I have some reservations, you know, about it, but I'm here to respond to what the community says they need and want. So, you know, there's a lot of challenges. I think the fundamental challenges that we're facing are twofold. One is the commodification of housing. It's, you know, it's completely unregulated relative to cost, you know, and price here in Massachusetts, not completely, but very lightly regulated. And then on top of that, we don't provide, there's not enough living wage jobs in America. Never mind in Boston, never mind in Massachusetts. For every 10 people, there are only 6 living wage jobs. Hello. So, you know, if you, all right, you got your, you know, you got out of shelter, you got through transitional housing, you got your apartment, and now you want to buy a house. Well, if you don't have one of those living wage jobs, you ain't getting a house. So there are some systemic problems that underlie, I think, the foundational obstacles to homeownership. That said, we have some tools that we use as workarounds, right, to those systemic issues. And those include what we call demand side solutions, like down payment assistance, subsidized mortgages, things like that, that help people afford more home if they can support a mortgage. That requires you to be bankable, right? You gotta, a bank has to be able to underwrite your income and your credit score and all that other stuff. And then on the supply side, we have some tools to produce units for sale that we can sell for less than the market, right? And then that, in theory, is supposed to, you know, create opportunities for some people to access homeownership despite some of the systemic structural obstacles that we see. Those tools are imperfect. I'm looking up at my wall because I have quotes, and one of my favorite quotes right now is "Perfection is the enemy of progress." You know, I wake up in the morning and I look in the mirror, and people who know me, I say it to myself, I can do this effed up or not at all. And so really there's a lot of things that need to be changed about, you know, a lot of things need to be changed in this country to really address some of the systemic and fundamental challenges that are causing housing issues and aggravating homelessness, right? But in the meantime, we have some tools in front of us, and I actually get up every day and I pick up those tools, as imperfect as they are, and do the best that we can with.
You do the best. Do the best.
We try. We are doing the best for people that really deserve that and more.
So I'm going to move through 3 more questions real quick because our last guest is going to be amazing. Not that you all weren't, everyone was amazing tonight, but I'm gonna actually remove the housing piece from this question just because I'm curious in what your general answer is. A policy in general that you would just like to see put in place at the city or state level.
I would like to see campaign finance reform and public campaign finance.
Did you say that for me or did you just say that?
I think the true forefront of civil rights is not my right to vote, but for my right to vote somebody who will represent me. And I see money in politics as a fundamental obstacle to that, when corporations are people too. When it comes to campaign finance, it just makes it that much harder for people with lived experience to assume roles of power, right? And start to pull the levers. So some days when I'm like, the effed up isn't good enough, I think I'm gonna abandon it all and go do campaign finance, you know, campaign reform work and get like evil money out of politics and stuff like that on a bad day. And then I come back and do like the only thing I'm good for, which is to frig around with silly affordable housing resources and policies.
Oh, I think you just added a new call for July about campaign finance, because that's something that I have been talking a lot about during this, because I never realized it until I ran for office how effed up the whole thing is. My lord.
Molly chatted me that she thought I was going to say reparations, but you know,
I thought you were going to say that too.
The Congress.
Right.
So it's just a means to an end.
So I'm going to ask you real quick, what drives you to do this work?
Other than schizophrenia?
Oh my gosh, girl.
I'm sorry, I apologize for anybody that I might have triggered by that comment. It's, let's see, what drives me to do this work? I think it's my lived experience. It was, as a young kid, I was housing unstable myself. My mom was actually a social worker who worked with youth. And so back in the day when I was a kid, they called homeless youth runaways, affectionately. And I was just raised up with them. And as much as my mom worked to help them, that was us too. And I fell into housing kind of by accident when I finished college. I majored in African-American literature. It turns out you can't eat it in terms of getting a living wage job. And so I actually took that first job answering the phones at that quasi-public because it was a living wage job with fabulous benefits. And the rest is history. And, you know, at one point in my career, I was standing in a building that we had preserved. It was affordable housing that was going to be lost. And I was working for Madison Park 15 years ago. And we put together the financing to improve it and preserve it and make sure that it'll be affordable forever. And there was this moment when you get something called a certificate of occupancy. It's like you finish the construction and it's the piece of paper the city gives you. And people can't move in until you have that piece of paper. And I was standing in the hallway the day after we got that piece of paper and the building was completely empty. And I found the intersection of my personal experience and my professional experience. And then, like, you know, the next day there were kids running up and down the hall and people were banging up the wainscoting, moving their, you know, furniture in, hanging Scooby-Doo sheets in the window, and like life rushed in. And I felt like I found some purpose, right? That also intersected with my lived experience. And so I think I feel compelled to bring my lived experience to this work. It's rare that I sit at a table these days with somebody who has experienced housing instability or dependence on public assistance. And so I kind of feel an obligation in a good way.
I feel
to
you
do
on that.
this work at that point.
I absolutely feel you on that. Anything to plug real quick before we move on to our last stellar speaker, who is actually probably used to waiting for you to finish up talking before they start talking?
I do have to mention that I work for Madison Park Development Corporation, which was founded 55 years ago. We're actually celebrating our 55th anniversary. Madison Park was founded before community development corporations even existed. After the battle with the city and the state against disinvestment and then urban renewal, the destruction of the community from eminent domain, the exercise of eminent domain powers, our founders, say some of their names with me, Ralph Smith, Vinnie Haynes, Beryl Roach, downtown to the BRA, and they said, we'll take the keys back. Thank you very much. And their legacy is what we now know as Madison Park Village, which I consider a superlative example of what communities can look like if you let the people who live there design them and implement them and own them. You know, they can be very, very healthy, vibrant, joyful places. And so just on this 55th anniversary of the founding of this organization, we're doing a year-long celebration. So I invite you all to visit our website, www.madison-park.org, and check out the events. If you have a minute to learn the history, I think that's great. And if you can join us for any of the celebration, we'd welcome you.
Thank you, Leslie, for I've seen you in meetings all day today, so I'm so grateful that you stayed here tonight. And thank you. You're an inspiration to me. And I appreciate everyone who is still on this call when we are running 27 minutes overtime, but I absolutely need to talk to our next person. So I'm going to have Molly introduce them before we end our evening.
So thank you, Leslie. And our next and last presenter, change agent, is Samantha Montano. I think JP, resident and activist, is the title I'm announcing here.
We're gonna start with
Perfect.
that.
Thank you, Sam, and welcome.
I wouldn't be surprised.
I think
She
so.
fell asleep. You there?
I do enjoy a nap. Yes.
I was just saying how like, oh, Sam's used to waiting for Leslie to finish speaking.
We have been on many a racial equity committee together. Yes.
So thank you for being here tonight. I'm really grateful for you to wrap this up because I love everything you ever say. And let's just start introducing you to people with what has your role been in the landscape for the fight of affordable housing in Boston?
So I work for a community development corporation in JP. I also have an elected seat on the neighborhood council. I don't serve on the housing and development committee because I'd have to recuse myself frequently. But I'm on the public service committee, which does restaurant licenses, and they intersect anyway. And then I have also served on several impact advisory groups, and in my free time do all of that stuff, you know. So it's like it's a weird mix, and it's never separate, and it's all connected. And
How many years?
I've been in Boston 8 years. I've been in JP 6 years.
Have you been doing this work for 8 years too?
My first like job outside of AmeriCorps was working in a congregate shelter. And it's not Empath, it was Crittenton's women's shelter in Brighton.
So you just dived right in. Thank you. Biggest question of the evening that I don't expect you to have an entire answer to, but I know you have opinions on and you've spoken about before. How did we get into this housing crisis in the first place?
I mean, how did we originally get into it?
I mean, like, please, yes.
We commodified private property. That's my answer. Is in the United States Constitution, we decided that people could be landowners. And so instead of like allowing people to have access to all that they need and everything that they would require, or like communal access to land or communal access to housing, we decided that people could own large swaths of land and could develop it and could do sharecropping on it and hire folks and enslave folks to work on that land, right? So to me, it all stems from that. Like we came to this country and created like the ability to own private property, I think.
And if we couldn't, if that didn't happen, is there
We could have like universally publicly owned, like we could have socialized housing, we could have access to like government controlled housing. I don't understand why people need to own I personally don't understand why people need investment properties. I know that people own multiple properties. To me, like when people don't even have one home, what is it to say that people can own multiple homes? You know, like why that seems excessive in my case, in my opinion, but also like I know that's the reality, right? That's just like
Right.
the culture we've created.
I hear you. That was a great, really succinct answer to how we got in here. So thank you for that. Pretend I know nothing, like I've said to the guests before, but switching over a little bit, will building more housing stop displacement?
No. Because when you build more housing, that doesn't affect the market value around it. So like building more housing inherently makes an area more appealing to other folks. And that causes private landlords, which I just like addressed, right? Like private landlords to raise their rent. And that doesn't stop people from being displaced. What building more housing in theory, and one of the theories is like Reaganomics, right? Trickle down economics, right?
Mhm.
They think that in theory, over time, building this housing will allow rent prices around the area to fall, which we kind of saw during the pandemic a little bit.
Oh, I got my apartment.
Yeah, it's not long term, right? Because things went back to like capitalism as usual. So that's why I think I'm so pro like land trusts, so pro government controlled housing, social housing, because that's a way to take away the commodification of housing, so that it's no longer a way to build wealth, and it's just a social need, like a human need.
Real quick for those watching who aren't amongst friends, a land trust is
A communally owned piece of land that, so like it doesn't get passed down and it doesn't accumulate wealth for an individual, but it allows for folks to be stable in community.
awesome. Thank you. So what are some measures that you think that we could take as a city to avoid displacement, but also make housing affordable, truly affordable, which you can define if you want to, and abundant? That's a big question.
I think truly affordable is around 60% AMI, which I think is 50,000. Is that right, Molly? 60%,
Someone in this room gonna know.
60% AMI is 60,000? I'm hearing 60,000 from the audience.
Who's next to you?
Sasha, good friend.
Oh, hi.
It's 56,400.
Oh, yes.
Closer to me.
So like if that's a family, right? That means the family is probably not making a ton of money. So if that's a family of 4 with 2 incomes, they're making minimum wage, if that. If that's an individual, they're a young professional at some like nonprofit job. So it's not like a ton of money. And it's also like assuming that, we have to create multiple tiered incomes for folks, because eventually people will be priced out. There's always like that cliff we talk about in like social economic things. So like people will reach this cliff where they're no longer qualify for social programs like SNAP, Section 8, whatever it is. But we created a gap, so there's nothing to fill it. So then folks no longer qualify for those programs, but they also don't make enough money to do anything else. And so we have to like figure out a way to develop housing in that gap. And it's hard because there's not, like, I don't know Excel sheets quite like Leslie knows Excel sheets, but figuring out that financing is incredibly difficult, because we create subsidies for like 30%. We create subsidies for like 60, 70%. We don't create subsidies really for those other tiers. And so it's a really difficult position to be in. So I think it's just like deciding to fund these things. Like, it's not like our state is poor. Our Commonwealth is wealthy. Like, our Commonwealth is very wealthy. And so we just have to decide to like put money into these things. It's like universal basic income. You just give money out. You just got to give the money out. And it's not like, I don't know why we're hoarding the money. We need to like give it to the people, because that's, if people succeed, and we've seen from universal basic income programs that like giving people a couple $100s a month will allow them to find a job, will allow them to get stable housing, will allow them to pay for childcare, will allow them to do all these things. And just like those couple $100s really helps people succeed. And so I think that's one of those steps we need to take to like be serious about housing. It's just be like, here's $300, take it, do something, get a unit you need. Like,
I'm all about it. And that was a very short answer to a very big question, but you hit most of the points. I'm gonna also ditch the housing side of things, but you can answer however you want. What is a policy that you'd like to see put in place, city or state? It could be around housing, but it could also be around something that could help people to build wealth or, afford housing.
I think something simple that I quite don't get, I don't get like the hesitance, is like rent stabilization. Like, if we can just cap rent increases at 3% a year, like, I think that's totally healthy and fine. It's not, I'm not setting the landlord's rent, right? I'm just saying don't raise it more than 3% a year. Like, I'm not telling that landlord they can't charge an outrageous amount. I'm just saying you can't also jack up my rent a couple $100s after that, right? Like,
I think that's fair. Yeah.
And I think it's just got like poor marketing. because
because it's been being marketed as like just total rent control.
Yeah, you can set your base rent at what, like, if you know it's coming, whatever, jack up your rent, but like you can't jack it up more than 3% each year.
No, and I mean, we both know households that the landlords come to them like a month before the lease is up and it's like, hey, yeah, I'm jacking this up $500 a month. Like, you can't.
I know someone who has a leaky gas oven that leaked in the middle of the night and almost poisoned them, and their rent went up 10%. And I was like, you better sit down with that landlord and be like, look, I need this oven fixed. And people are afraid to do that. And I think that's the other thing, maybe tenant protections that we should
Yeah,
really.
no, there's a real fear, which is why I'm all for tenants organizing. Work together. So is there anything that we didn't touch on that you would like to touch on before I ask you what drives you to do this work? Because I don't want to cut your time short. And I appreciate everyone still on the call.
I just think everyone should always become friends with their elected officials, join impact advisory groups, because a lot of times these groups are like mostly homeowners who are there to watch out for their home ownership values, which, you made that investment. Okay, that's valid, but also we need various people at the conversation, various people at the table. So I know everyone's tired and everyone's like doing this work all the time, but it's also important to participate if you can.
It is. And I'm going to end with what drives you to do this work / do you have anything to plug? Because there might be an event tomorrow you might want to plug. Maybe. But what drives you to do this work first?
I very much believe in, as like someone coming from like a single parent household, right? Like always watching my mom struggle financially. I think it's ridiculous that we have to we moved. I'm used to, this is the first year in 15 years that I haven't moved.
You move a lot.
So this is the first year I re-signed a lease. I'm going to be in this apartment 2 years, but since I was 13, okay, so more than 15. So since I was 13, I've been moving every year because my mom couldn't afford her apartments and we couldn't afford homes and like all those things. So we move. And so for me, like the ability, doing this work is important because like that stability is incredibly important. And I think that, I personally don't believe in generational wealth. I think you either spend it in your lifetime and it's gone. You either can spend it all and then we should give it back to the government.
Interesting. We'll talk more.
But I know that's not popular, obviously. But that's why I do it, just because, these are easy these are fixes that we can make. And
Right.
I don't like pretending that they're not things we can fix, right? Because these are all things we can fix.
I completely agree with you. Anything you want to plug before we
go
ahead.
Oh yeah, if you live in, either way, Jamaica Plain Neighborhood Development Corporation is hosting a donor event / party with free food and free drinks, beer and wine, I think, in the small brewery complex tomorrow at 6 p.m. on the Miriam side. So like if you're familiar with the area where Bella Luna was, that corner, we're going to be like around the corner from there with tents and whatnot. If you want to donate, you can. If you can't donate, you can also attend. It's on the website to register, or you can just show up, I'm sure. Although I know that our planner is nervous about food, so they would rather you register.
Understandable.
For food reasons, yes. But if you're around JP, come through tomorrow, 6 p.m. The small brewery complex. Small business brewery complex.
Thank you, Sam, for we are 40 minutes overtime, and I'm so appreciative that I know we all worked really long days and there's still 8 people on this call, and I'm so grateful for all of you. I want to thank Larry Siemens, Elizabeth Jackson, Ari Barbanel, Molly Goodman, and then in the background, someone you didn't see tonight is Tess McColgan, my campaign manager, Samantha Montano. I got everyone, yeah, Leslie Reed, and we just posted all of the information you could ever need about me in the chat. When you're watching later on YouTube, I'm gonna do the point down. All the information is gonna be down here. We normally open the floor for questions right now, so I don't want to not do that. I also understand if everyone just wants to go the heck to bed, but if anyone has a question right now, I'm willing to stay on and answer. We also have that first link put in the chat where you can submit ideas for progress, policy, anything. Does anyone have any last words for this Wednesday evening?
Make sure you're registered to vote.
That would help. The primary is on Tuesday, September 14th. All right.
You know what the last day to register to vote in the primary is?
very soon.
Probably. We should find that out.
Yes. Hold on, I know it.
Slash stop recording.
No, I was waiting to find out when they were doing the mail-in voting. Yeah, we're gonna stop recording now because I don't know yet, but we'll post it up on the website. Thank you everyone so much. Sorry, I don't know that information off the top of my head. I am tired, as we all are. Thank you everyone for being here tonight. This has been amazing. If you're watching now, thank you for being here. If you're watching later, thank you so much. You can always reach me at kelly@votekellyransom.com. I'm super grateful to have all of you in my life, everyone who is in this space tonight. I'm so grateful to have you in my life and guiding me and showing me the way and giving me constant information, and the work that you do is life-saving, and we wouldn't be the Boston that we are without you. So thank you so much. And at that, I'm going to say good night.